Good evening, ladies and gentlemen. I'm Randy Saplina, and I'm here to talk to you about DVTs. DVT is also known as deep vein thrombosis, and it's when a blood clot forms in a part of the body. And when that blood clot forms, it doesn't pass through like it should, and it clumps together and it forms a blood clot. Blood clots are formed because patients are either immobile, have surgery, or in a trauma, and they are not moving like they should be. So other causes of blood clots are when a vein's inner lining is damaged and injuries are caused by physical, chemical, or biological factors that are damaged, or the blood is just sluggish and lacks that motion that needs to help get it pushed and going. So your blood is thicker normally and it's likely to clot and it needs extra help. So DVTs are not normally common in a normal person that's up and moving like they're supposed to. So patients that are hospitalized are more common to get DVTs. So some risk factors are patients that are more prone to getting a DVT is if you have a history of DVTs, patients that are on birth control. So some patients that are younger can get DVTs, but it's more likely for patients that are elderly. Obese patients are more likely to get DVTs because of the plaque buildup in the arteries. Patients that have cancer are more likely to get DVTs, and also patients that are surgery candidates. So some signs and symptoms of DVTs are some unexplained shortness of breath, pain with deep breathing because you're not getting that oxygenation. But like I said, if you have that plaque buildup in your heart, you're not moving those arteries, and so you're having that buildup, and that's a sign of a deep vein thrombosis. But also, the number one sign or location of a DVT is in your arms or legs. So if that blood clot dissolves and it moves to your lung, then that becomes a PE, which is a higher sign and more incidents where that's a bigger problem. So some other signs and symptoms are some swelling in the lower extremity and coughing up blood. So some diagnosis is if a patient starts having any of these signs and symptoms that I just listed, then some lab work or tests that we would probably run would be a D-dimer or an ultrasound, because an ultrasound is really the number one test that providers order to see if a clot can be detected, and it's the most non-invasive test that can be run. So some treatments that can be used for DVT would be to stop the DVT from getting any bigger and to prevent that blood clot from migrating anywhere in the body. Like I said earlier, a PE is what we want to prevent. So if we can prevent that blood clot from migrating, that's going to be what we want to happen. So the physician can start the patient on an anticoagulation medication. That can either be a drip or it can just be a sub-Q medication called heparin. Heparin either comes in a drip or sub-Q. Or if the doctor doesn't want to go that in depth, then they can just start them on some oral medication like warfarin, Coumadin, or some medications like that. But also just getting the patients up and ambulating them is a good way to get the patients up and moving. So in conclusion, DVTs are preventable. Getting patients up and moving, patients after surgery, getting them on a sub-Q heparin regimen right away is a way to, it's not preventable, but to get them up and moving, getting them on that sub-Q heparin will help prevent, hopefully, some DVTs and getting these patients moving. So any questions, just let me know.